So welcome all to the Pathology Snippet 1 Glycogen Storage Disorders review. Before starting with the topic, I would like to introduce BVDMC Quizzing Society. The BVDMC Quizzing Society has come in place in the year 2024, and we have had 138 members in the WhatsApp group with 18 members as the leadership board. A brief introduction about myself. I am Dr. Ameyanil Munemane, founder, president of the BVDMC Quizzing Society and intern at Bharati Vidyapeeth Medical College, Pune. Before actually starting with the topic, let's understand that why the idea of snippets. So coming Saturday, that is on the 31st of August, we are planning to organize a intra-college pathology quiz for second and third years of Bharati Vidyapeeth Medical College, Pune. So these snippets will serve as a quick revision tool for those students preparing in the quiz. But not just the quiz, even otherwise, the medical doctors and students who want to revise this topic can do so easily with this video. Now let me start describing the topic of glycogen storage disorders. So starting with pathology snippet 1. In total, there have been 15 glycogen storage disorders which have been identified, out of which as medical students and students of PG entrance examinations, we are expected to know 9 of them. The 9 are from GSD 0 to 7, that makes 8 of it, and GSD 11, that is the 9th. Now in this video, in this section of the video, I'll only be describing the names of the glycogen storage disorders. And later, when I'll be discussing the mnemonics of this, I'll go in a further detail about the enzymes. So GSD 0 is further divided into GSD 0A and GSD 0B. GSD 0A is caused by the enzyme deficiency glycogen synthetase 2. Liver is the organ involved in GSD 0A. Whereas in GSD 0B, the enzyme deficient is muscle glycogen synthase. The organs involved are skeletal and cardiac muscle. Both GSD 0A and 0B are called as Lewy disease. GSD 1 is again divided into GSD 1A and GSD 1B based on the enzyme deficiency. Both 1A and 1B are called as von Gierke's disease. GSD 2 is further divided into GSD 2A and 2B on the enzyme deficiency. GSD 2 is called as Pompey's disease. GSD 3 is called as Anderson's disease. GSD 4 is called Corey's disease. GSD 5 is called McArdle's disease. GSD 6 is called Her's disease. And GSD 7 is called Torrey's disease. Here, I'm sorry, actually GSD 3 is called Corey's disease, a slip of tongue from my side. GSD 3 is called Corey's disease, GSD 4 is called Anderson's disease. So now let's go into the details of it. Before really telling you the mnemonics, let me tell you the clinical features of these glycogen storage disorders. So GSD 1 is von Gierke's disease. The clinical features you need to know is severe hepatomegaly, hypoglycemia, and hyperuricemia. GSD 2 is Pompey's disease. The clinical features you need to know is cardiac failure and cardiomyopathy. GSD 3 is Corey's disease. And the clinical feature is that it's like GSD 1 but in a milder form. GSD 4 is Anderson disease. Here the main clinical feature is cirrhosis. GSD 5 is McArdle's disease. McArdle's presents with muscle cramps and myoglobinuria. GSD 6 is Her's disease, having milder hypoglycemia. GSD 7 is Torrey's disease. It is similar to GSD 5. Now, let me go to the mnemonics. Believe me, these mnemonics are designed in such a way that it will be difficult for you to forget the glycogen storage disorders. I mean, that's not a promise, but that's a try from my side. Now, I request everyone watching this video, a medical student or a doctor, to take out their notebooks while they are watching this segment of the video. I'll be sharing 4 mnemonics with you, which will help you to remember the glycogen storage disorders and their enzyme deficiencies. Starting with the first mnemonic, which will help you to remember the names of the glycogen storage disorders. The first mnemonic is वो physics, chemistry और वो physics और chemistry में होशियार था. Repeating the mnemonic, वो physics और chemistry में होशियार था. Okay. Now, type 1 is von Gierke's disease, वो. Type 2, Pompey's disease, physics. Here there is an alteration in the mnemonic. I first talked about or. I first talked about or. So, but it is the opposite way. Chemistry comes first. So chemistry, GSD 3 is Corey's disease. GSD 4 or is Anderson's disease. GSD 5 May, McArdle's disease. GSD 6 होशियार, Her's disease. GSD 7 था, Torrey's disease. The second mnemonic is to remember the various enzyme deficiencies involved. So the mnemonic is 16th Prime Minister is ABCDMMHH. Again repeating the mnemonic, 16th Prime Minister is ABCDMMHH. Here 16th can be divided into 1 and 6. So GSD 1 is von Gierke's disease and the enzyme deficient is 6, that is glucose 6 phosphatase. PM, P standing for Pompey's disease, which is GSD 2, the enzyme deficient is M, that is lysosomal maltase or acid maltase or lysosomal acid 1,4-glucosidase. AB, Anderson's disease, which is GSD 4, has the enzyme deficiency of branching enzyme, whereas Corey's disease, which is GSD 3, has enzyme deficiency debranching enzyme, hence ABCD. MM, McArdle's disease, has enzyme deficiency of muscle phosphorylase. HH, Her's disease, has enzyme deficiency of hepatic phosphorylase. Coming to the third mnemonic, Pompey's disease, which is GSD 2. P for Pompey, P for pediatric. Just a second. Sorry for the interruption. So P for Pompey's disease and P for pediatric population. Now what is pediatric population best at doing? Apart from playing tantrums and crying all the time, pediatric population has a good heart. So all the clinical features in Pompey's disease will be related to the cardiovascular system, that is heart, which are cardiomyopathy and cardiac failure. Pompey thrashes the pump. Here the word P in the word Pompey has come at the first and the fourth position. Hence the enzyme deficiency is lysosomal 1,4 or lysosomal acid 1,4-glucosidase. Coming to the fourth mnemonic. The mnemonic is GSD 127 gap. I am repeating it. The mnemonic is GSD 127 gap. That means GSD 1 has a deficiency of glucose 6 phosphatase. GSD 2 has a deficiency of acid maltase. GSD 7 has a deficiency of phosphofructokinase. Apart from this, I would like to share a fact with you, a very interesting fact, that in Pompe disease, there is accumulation of glycogen in the lysosomes. That is why this is the only glycogen storage disease which is also considered as a lysosomal storage disease. A very favorite INI CET exam question. Which of the following is both a glycogen and a lysosomal storage disease? Answer: glycogen storage disease 2 into bracket Pompe's disease. Another interesting fact is that HERS disease has a mild hypoglycemia. A previous year NEET question. So thank you for patient listening. This marks the end of Pathology Snippet 1 Glycogen Storage Disorders review. If you like the video, please share it with your medical colleagues, friends, and doctors so that they can enrich their understanding about glycogen storage disorders. Thank you.